Good evening, everyone. Thank you for joining us here tonight for Dive into Medicareers. My name is Niran, and I'm delighted to be your host for tonight. I hope that you'll enjoy tonight's session and take away something useful from it. Today, we will be focusing on pharmacy, and joining us here is Dr. Renukha, the head of the School of Pharmacy at Taylor's, and Angeline, a third year pharmacy student. They will be sharing with us here today information about the field of pharmacy and their experiences of how they got to where they are today. So, for just a rough idea on what we'll be doing tonight, we'll start off the event tonight with a talk by Dr. Renukha, then a talk by Angeline, followed by a Q&A session at the end for everyone to clarify any doubts you may have. Feel free to type your questions in the Slido link provided in the chat box as you proceed with the event, and remember to indicate which speaker your question is for. Kindly refrain from typing questions into the Zoom chat box. Before we begin, make sure to read the housekeeping rules posted in the chat box and please abide by the rules, or else we will not hesitate to remove you from the meeting. Without further ado, Dr. Renukha, the stage is yours.
Thank you, Niranjana. I'm going to share my screen. I believe you can see my screen already.
Yes, we can see your screen.
Okay. Good evening, everyone. Thanks for joining this session. And of course, thank you to the Taylor's Pre-Med Club Organizing Committee for organizing this session. So, like Niranjana has introduced me, I'm Renukha, and I'm the head of school for School of Pharmacy at Taylor's University. What I'll be doing is basically to talk to you about what's pharmacy and what are the different fields of pharmacy. At the end, I'll also share a bit of my own journey as a pharmacist and to where I am today. So, what's pharmacy? So, I assume pharmacy is not a new term to many of us. So if you look at the word cloud here, the among the things that will come up is medical, healthcare, clinic, patient, customer, drugs, and safety. So that's rightfully so. Pharmacy is everything that is dealing with drugs, safety, healthcare, patient, and treatment. So, pharmacy is actually a science and technique of preparing and dispensing the drugs. The Panadol that you take, those are what we call drugs. I'm not referring to all the cannabis and morphine, okay? When I say drugs, it's drugs for treatment. So it's more to science and technique of preparing and dispensing of um, drugs, as in medicines. And it's a profession, it's a health profession that links health science with chemical science. It also predominantly focuses on the safe and effective use of pharmaceutical drugs. So as a pharmacist, a lot of the time the conversation is about whether the treatment is safe and then effective. Safety comes first. So pharmacists, when we the term pharmacist actually refers to the individual, the expert on drug therapy, and the primary healthcare professional who optimize the use of medication for patients. Means it is the person who has the knowledge and skill who can make sure that the medicine is safe and works well for a patient. So when we talk about pharmacy discipline, is probably one of the discipline which is pretty broad. It encompasses from medicinal chemistry, pharmacology, pharmaceutics, and pharmacy practice. I apologize for all the jargon, so I'll try to explain all these jargons. Medicinal chemistry, in lay term, it means that the process of identifying new drug entity, synthesis, chemical synthesis, very heavy on chemistry, trying to optimize the structure of compounds and synthesize new drug, can also be through computational method. So that is medicinal chemistry. We also have, as in pharmacists also learn on pharmacology, which means, simply put, it means that drug action on human body. What does the drug does to the body, and what does the body does to the drug? That is what you study in pharmacology. And pharmaceutics is the science of designing the drug, formulating the drug, the eye drops that you see, the tablets that you see, the inhalers that you see, the injections that you see, all that came about from this discipline of pharmaceutics. Means the medicinal chemist will come out and say, okay, this compound has got some potential. The pharmacologist will take on and then study the effect of that drug on body, and then uh, the pharmaceutics person will take and design it as a delivery system. So pharmaceutics is the science of the delivery of drug, and then goes to pharmacy practice where you actually use the drug, and it's about optimizing the use of medication and the uh, optimizing the use of medication in humans. Okay, so that's pharmacy practice. So pharmacist is a healthcare professional, if I've not mentioned that by now. So pharmacist is one of the healthcare professional. Okay, in terms of, for I was told that most of you are probably in your pre-university level. So if in terms of you are not still not clear what is the scope of a pharmacist job, I must explain to you that traditionally pharmacist role used to be very different. means in 1990s or so, the role of pharmacy is really very different and it has evolved to where it is now. So my task today is also to sort of tell you the story of that, how it evolved. Traditionally, pharmacists is predominantly working on compounding that drug because we are supposed to be expert in mixing those drugs and coming up with a good formulation and how to apply it and then dispense to the person. So traditionally, that's what we do. But in this era, that role that has evolved has moved more from the product. We don't really focus on producing the product, manufacturing product, but we go more towards the pharmacy practice side where we actually look at clinical services. Clinical services means the services that involve real human patient, okay? Reviewing medication for safety and efficacy in their use in patients and providing drug information to patients and other healthcare professional or even to public. So that's where the scope has changed. It used to be very heavy on product, but now it more on patients. So let's talk about really how does it evolve. So this is Charles and Alderton is probably one of the first pharmacists in 1885. He actually a pharmacist who worked in a drugstore, and he invented a soft drink called Dr. Pepper and was marketed because of its unique flavor to the carbonated drink. He's really a pharmacist, so that's where the early age pharmacists were. And then most of you may not know Sir Alexander Fleming. He is a doctor, microbiologist, also a pharmacologist. So he's the first person who discovered penicillin. Penicillin is the first ever antibiotic that was discovered and used and actually saved millions of people because it prevent infection. Antibiotics prevent infection. And as I mentioned earlier, uh, previously pharmacist role was really very product oriented, compounding medication, mixing. Although it's really fun, that's one of the things that I still remember from my lab days. I really enjoyed making those creams and tablets and all that. But that's really the past. We don't really do this anymore. By that we mean that last time it used to be the doctor just write the ingredients for the medication and then it goes to the pharmacist and the pharmacist compound that medication according to that ingredient and dispense and counsel the patient. That's where it was, but it's becoming less important now. This is what currently pharmacists do. Pharmacists oversee the preparation of the procurement, the storage, and distribution of medicinal product, but more to role two, where they really provide effective medication therapy management, maintain and improve professional performance as a profession, and contribute to improvement of effective healthcare system and public health, means to improve the efficiency of the healthcare system. This is where the pharmacist role are at. So what I covered is really what are the diverse area of pharmacy. I talked about all the jargons, medicinal chemistry, pharmacology, pharmaceutics, and pharmacy practice. And I sort of briefly walked through what were pharmacists doing last time. They used to work in drugstore and come up with some carbonated drink with new flavor, and then came about Sir Alexander Fleming, who came out with the first antibiotic, and then we used to do compounding. But now I'm telling that no, we are more patient oriented. So that is sort of the scope. But where do we work as pharmacists? This is really where we work as pharmacists. The area is really very diverse. Something that you always see is, of course, community pharmacists. We work in the hospital. We work in academic and research, like what I do. We work in the pharmaceutical industry, i.e., the drug manufacturer, pharmaceutical companies like Pharmanaga, AstraZeneca, Roche. Those are the names that you may know. We are involved in clinical trials, means when the scientists, the researchers come up with medicinal product, they has to be tested on humans first. So there will be pharmacists who are experts in clinical trial who are experts in the testing of drug in humans and then reporting its safety and efficacy. Pharmacists are also involved in regulatory and enforcement, where we look at the how the how to say whether a new medicinal product meets all the requirement of safety and efficacy, and whether all those laws related to use of medications are being practiced at all health facilities. So that's regulation, and of course other areas which I'll mention. So community pharmacy, this is what you're familiar with. Uh, these are pharmacists who are primary healthcare providers, i.e. they are in the community, they are accessible to public. However, the nature of their job scope is a little bit business oriented, um, and they deal with a lot more over-the-counter product which you can get, such as Panadol, such as all those gastric medication. Those are all called over-the-counter product. They do fill a prescription. If you go that with to them with a prescription, they can also dispense prescription. They do counseling a lot. They teach you how to use certain medication, how not to mix certain medication. They involve in health promotion programs such as to reduce obesity, smoking cessation, and things like that. So pharmacists in the retail, their role is also adapted to where they are located and their nature of their work. Okay. And hospital, so hospital is where really pharmacists really do a lot, but often go unnoticed. Here are the services that the pharmacists offer in the hospital: highly specialized, highly technical knowledge and skills that they do. The first one is total parenteral nutrition. Again, a jargon that I must explain. It actually means that if you notice some patients, when they are really severely ill, they cannot take food like how we do. And so if this is prolonged, if it's just one day, they can still just give glucose sugar drips and then supplement, that is fine. But if it's a prolonged condition where they cannot take food for ever or for few months, and so the sugar solution alone won't give them enough nutrients, because we just don't need sugar. We need vitamins, we need fat, we need carbohydrate, we need protein. And so that's where total parenteral nutrition is comes into place, where the pharmacist, you will be taught, and you will have also role to actually mix this bag according to individual patient requirement. So the doctors will actually tell, okay, this patient's got this body weight. I want him to get this many calories in a day, 1,500 calories a day. And particularly, please make sure that you supplement his potassium, because his potassium has been low and today this is value. So the role of a pharmacist is to calculate according to the calorie requirement, how much of protein to put in, how much of lipid to put in, and the whole construction of that bag that you're going to infuse to that person requires a highly specialized technique and environment. So that's where the pharmacist role come in. Drug information services, it's related to the role of pharmacists as the primary source of information for the medicine information to healthcare providers, patients, and public. So you can call them up and ask, can you explain to me, can you check if this drug is safe for a 4-year-old? Can you tell me how much do I give to a person who is severely burnt with burn injury? So those kind of services that the pharmacists do. Cytotoxic drug reconstitution, it's similar to TPN. It's just that this time you deal with all those drugs that is cytotoxic, i.e. cancer drugs. So they are really very dangerous drug that requires specialized environment and technique to produce. TDM is a service that pharmacists in charge, they monitor the level of drug in blood. There are certain drugs that are very sensitive. They are sensitive to, means if it's too high, you can have toxicity. If it's too low, you will have no effect. And unfortunately, these are also the drugs that easily affected by food, by disease, and things like that. So what the doctors will do is, let's say they suspect toxicity, they suspect that this person has got some adverse unwanted effect due to a drug. So they'll draw the blood and send to TDM pharmacists for them to say what's the level. And if this is the level, what do I do? So that's the job of the pharmacist. Tell what is the level? Is it safe? What do I do? Withdraw, stop the drug or reduce the dose and retake the blood after how many days. So those are what TDM pharmacists do. Outpatient pharmacy department, I'm pretty sure most of you have seen it. It's mainly a pharmacy department in the hospital that supply medication to patients who go to the hospital and see the doctor at the clinic. Means if let's say you bring your grandparents to the medical clinic and then they see the doctor, after they see the doctor, they go to the outpatient pharmacy department, present with their prescription, and the pharmacist will dispense their medication. So that's OPD. It's highly intense working environment. Medication therapy adherence clinic is something related to the role of the pharmacist that I'm saying is evolving from product oriented to patient oriented, where pharmacists sit in the clinic. So the same clinic that you bring your grandparents or grandfather, say you see the doctor, then the doctor said, I think your grandfather needs some help with taking his medicine. He or she will refer your grandfather to a pharmacist who's in the MTech clinic to really go through the medication with your grandfather and tell which one is good, which one is bad, how is he been storing the medication, when is he taking the medication, things like that. So that's MTech. Inpatient pharmacy department is the opposite of outpatient. So basically, it's the pharmacy department that supply medication for patients in the ward. Clinical and ward pharmacy. So now this is interesting. So clinical and ward pharmacy, they are actually pharmacists in the ward. Rarely people notice because they call us kaka, they call us adik, they call us everything. And they always think that we are medical students because we are always very young. And so they will call us kakak, adik, usually kakak and adik lah, thankfully. So clinical and ward pharmacy, we call them clinical pharmacists. What they do ward rounds. They join doctors for ward rounds. They do bedside dispensing, means if the patient is discharged from the ward, these pharmacists will get their medications and dispense at the bedside. When a new patient come in, they do medication reconciliation. Means they see what has been taken earlier, what is being given in the ward, remove any duplicate, check any interaction. So those are the things that the pharmacists do in the ward. Medication counseling and a lot more. Home medication review. There are also pharmacists who visit homes for people like who really need help at home. Psychiatry people predominantly, some geriatric also. So this also is something that is being done by hospital pharmacists. There's a team that will visit to patients' home, check their medication at home and things like that. Harm reduction program. So this is also very interesting experience. Pharmacists are also involved in methadone replacement therapy. So methadone is actually a drug that can substitute drug dependence. So say people has been injecting themselves with heroin or cannabis and all that, and so they say that no, I want to stop, but they cannot immediately stop because the withdrawal effect and all that. So what we'll do is we give them substitution with methadone, we monitor and we taper them off. So pharmacists are also involved in this clinic where we go there daily and we prepare their methadones according to their doses, and then we monitor this patient. We take their urine to check that they are really clear from drug, because methadone is not excreted in their urine, but if they take the other drugs, it will be. So we check their adherence, we make sure they take their medication in front of us, we see if they can be reduced and tapered off. So those are the things that the pharmacists do in the hospital. Really mouthful, a lot of things, but all of these are usually behind the scene and so not very obvious. Academic and research, I guess nothing much to talk about. Is usually a pharmacist by training venture into academia to educate future pharmacists. At the same time, we do research, and what kind of research? Broadly can be divided into research in the lab, that deals with all that chemicals or microbes or animal cells and things like that, or even research with the lab. With, remember I told you about the drug formulation, so you can also do different thickness of tablets, different composition of tablet, and see their release profile. So those kind of research is done by pharmacists in the ward. You will also do, if you choose pharmacy, you also do that as part of your final year project. We also do surveys. We also assess medication use in the hospital. For example, let's say I want to see how, let's say I know that this drug, this particular medicine is not to be given to older people because it increases their risk of fall. And so I do a research in the wards, one of the geriatric ward in Klang Valley, to see how prevalent is this medication being actually prescribed to the patients, and how many of them actually come back due to a fall. So those kind of research is also done by pharmacists. Okay, now industry um, is, so I'm still talking about the various places that a pharmacist work. Huh? So we talk about community, we talk about hospital, we talk about academic and research, and now we're moving to industry. So in industry, pharmacists are predominantly involved in overseeing the manufacturing process, make sure they are done according to the good manufacturing process. They look at quality control, they look at quality assurance and all that. So that's the role of pharmacists in industry. I've mentioned about clinical trials, I mentioned about regulatory, I mentioned about enforcement. And so there are also other areas that pharmacists venture, but they are not very popular. Okay. Now, so is there still a demand for pharmacy? We always hear that there's no enough placement in the hospital, there's no enough spot in the hospital. Yes, there is. Actually, the target ratio that you want to have is one pharmacist to 1,200 individuals. But now we are still at one pharmacist to 1,600 individuals. So we are really not there at the ratio yet. So there's still demand for pharmacists. So all the hoo-ha that you hear that there's not enough space is mainly because of our healthcare system, where when the pharmacists graduate, we all think that we must go to the hospital. Government only hire pharmacists in the hospital. And so because it's government, they have limited job, limited posts because of the budget. So that's why it's limited. But the other areas are still really very um how say require more manpower. And also need to think that hospital is just not government hospital. There are also private hospital, and the pharmacy department in private hospitals are expanding, and we are still not there yet in terms of the ratio that we should be having according to a healthy ratio. So what's the future of what's the future of pharmacy? So I talk about past and present. Now let's talk about the future. Now we are very patient oriented, but the future of pharmacy is also, we're looking at more of specialization, which is already happening. We have some very, very, very good pharmacists who are very good in respiratory medicine, means medicine that is related to your lungs. Very, very, very good. Even I'm in awe when I talk to them. So very good in cardiology medicine, some anything that to do with the heart. So those type of pharmacists, they are now being recognized as specialists in this area. So that is really the future and where we are heading towards. Community pharmacy in Malaysia, the community pharmacy practice in Malaysia really requires a bit more, I'll say, advancement. If some of you who would have gone to other country or even neighboring countries like Thailand, you cannot get your medication from the same facility that you see the doctor. Means you see the doctor for a prescription medication slip, and you go to the pharmacist for to get your medication. So that's really the model that we are all heading towards, and that's the term that we call dispensing separation. We also have dispensing robots. So when the dispensing robots came about, there's really a scare among the profession to say, oh my God, the robots are going to take over my job. But again, not really. the main intention of dispensing robots is so that they can do all those automated things that doesn't require a pharmacist. Dispensing somebody else can do, but a pharmacist is required to look at the medication, review and counsel the patient. Okay. Medication therapy adherence clinic, like I mentioned earlier, we already have this quite a bit for diabetes, for renal, for psychiatry. So where are we heading towards? We are heading towards a pharmacist being given a list of things and having the autonomy to change medication within that framework that is agreed upon. Means they prescribe certain medication and adjust medication. We do this, but we just don't do it for all medication for now. Personalized medicine is another research area that is really booming, where we have identified that I and you respond to different medication differently because my genes is different than yours. And so I should be given a different composition of medication or different type of medication because my genetic is different. So that's really personalized medicine. You are trying to see, okay, what's the genetic makeup of this person? And so for this genetic makeup, what kind of medicines can I give? So those are the area of research that is really going. This I've mentioned about the dispensing robot. It doesn't really take away the role of a pharmacist, but more to open up more opportunity pharmacists to venture into other areas. Now, about my pharmacy journey. Um, so I graduated in 2009 and immediately I joined the government service at that time. So I did my pre-registration. Pharmacists also have got a pre-registration, just like a medical doctor. Means you call the doctor as housemans, right? So we call ourselves as provisionally registered pharmacists. So I did the pre-registration at Hospital Serdang. So at that time, Hospital Sedang was really new, nice, and neat, and I really enjoyed my time there. It's a computerized hospital, so I really, really liked the environment. Then after my pre-reg, I moved to Hospital Tengku Ampuan Rahimah, which is Klang GH, and so it's like the opposite. But I must say that I had the best of both worlds. Klang Hospital is a manual hospital. It doesn't deal much with computer system at that time, at least, which means in Serdang, I never see paper. It's a paperless hospital. Doctors put their notes in the computer system. I receive the prescription in the computer system. I see all the doctor notes. Everything is in the computer system. Their lab, their images, their X-rays, everything is in the system. So it makes things very easy and neat and a bit more easier. Whereas for Clang, I must say that I had a culture shock. I have no idea how to read the horrendous writing. I had trouble, a lot of trouble adjusting in Clang because that was my first time looking at a written prescription, trying to decipher all the codes. But I really enjoyed myself. So in Clang, so in Serdang as a pre-reg, remember I gave you the whole list of hospital pharmacy services. I went through all of them. In Klang, I am a registered pharmacist. I was a clinical ward pharmacist, and I was a ward pharmacist for a pediatric ward. I can tell you a lot more story, but I know that I don't have much time. So I was posted to a pediatric ward. The first day the person in charge took me to the ward, gosh, there were 60 patients in the ward. Pediatric ward means 60 plus 60 because it's impossible the children are there alone. 60 plus 60 patients, individuals in the ward, plus about at least 20 healthcare worker, doctor, medical students, nurses. It's really very crowded. But eventually they became family, and that's really where I learned a lot. It was really very interesting journey, creating that rapport, being useful in the ward, creating your presence. And I learned a lot to a point that every morning when I go for my own rounds before the doctors come, I look at that boy and can tell that he's 7.5 kg and he requires uh, 8 mLs of PCM. I don't have to calculate. Just, I was just, how to say, learning on the job and really enjoying it at the same time. So that's where I did my pre-registration in Serdang. Then I moved to Klang Hospital to do my fully registration as a fully registered pharmacist. So these are some of the things that I used to do. I used to follow rounds. I used to talk to the nurses, make sure the medication are stored properly, administered properly. So when I do my rounds, I check if the infusions are done properly, whether the I'll say the infusion sites are all healthy, whether the medication are all administered. So these are the things that I do as a ward pharmacist. I check the patients and their medication in the ward. But then it came to a point that I just wanted to do something. I did my pre-reg in Sedang. I learned all the hospital services, and I realized that clinical is where I want to be. So when I did my registered pharmacist tenure in Klang, I was a clinical ward pharmacist. I loved my job, but I wanted to do more. So I had this opportunity to do PhD, and so I applied for it at UM, and I got into a PhD program in UM. I was doing it part time, means I would go to work at 7 and do my rounds, and then finish everything by 11 and run to the library and do all my reading, and then go back again for my afternoon round and things like that. I was getting a bit more intense and logistically very difficult. So I actually resigned my government job and I did my PhD full time. After I completed my PhD, I um, didn't want to go back to hospital. What I did was I applied to university as an academic lecturer, and so that's when I joined Taylor's. I joined Taylor's in 2016. It's already 6 years in Taylor's. I joined as a lecturer. So it's really very interesting that I joined as a lecturer, then I climbed up slowly as a senior lecturer, then I became a program director, and then I now am the head of school. So that's my journey as a pharmacist. I forgot to mention that when I left hospital, I joined academia. I also did a bit of locum at community pharmacy. To fill my time to still keep in touch with the thing and also get a different type of exposure. So I did a bit of locum in community pharmacy, completely different experience. Like I mentioned, it is you deal with health promotion, you deal with over-the-counter product, you have to have some marketing, sales, entrepreneurship kind of skills. So those were the things that I saw and able to practice to some extent when I was a pharmacist. So in terms of education pathway, so if you're wondering, so how long does it take? What do I need to do as a pharmacist and where it takes me to? So this will summarize that for you. So say you are now in your foundation years, whatever foundation you are taking, the pharmacy course is a 4-year course. And so after the 4 years, you need to do 1 year of the pre-reg, and then you are now, and then you will be a fully registered pharmacist. Of course, the other pathway is to do the postgraduate studies if you want to. Just a note that in case you are looking for pharmacy programs in Malaysia and where are the offerings, you must make sure that, okay, pharmacist is a professional. So we are governed by the professional body, which is called the Pharmacy Board of Malaysia. The Pharmacy Board of Malaysia must recognize your degree for you to be able to practice as a pharmacist in Malaysia. So before you enroll into any pharmacy course in Malaysia, make sure that they are recognized by the Pharmacy Board of Malaysia. Okay, there's a list in the website that you can refer to. Pharmacy at Taylor's, I have to mention because I'm from Taylor's. Perhaps I should just highlight a couple of things. One that I would like to highlight is the flexible curriculum. Pharmacy at Taylor's is probably the only pharmacy school in Malaysia that offers an option to specialize in industry pharmacy or to do a minor in other disciplines. Example, after I talking to you, you think, okay, pharmacy is what I'm going to do. And so you enroll for pharmacy, but you said, I'm definitely not going to work in hospital. I can't stand the smell. I'm going to do community pharmacy. So you do a Bachelor of Pharmacy course, but you take a minor in marketing, for example, or you take a minor in entrepreneurship. So that minor option is something that is unique to Taylor's and unique to Taylor's Pharmacy. So that is something that I would like to highlight. And another thing that I would like to highlight is the fact that our school has got very good relationship with the pharmaceutical industry, especially the main players, the multinational companies such as Pfizer, Novartis, Roche, Johnson and Johnson, which offers you a 3 months internship. And the 3 months internship actually opens up opportunity both ways for the company and for you to identify good prospects after graduation. I think that's all from me. And I believe Angeline will provide you a very different experience from her point of view as a pharmacy student. I saw her slides are colorful. That made me happy, at least to some extent. At least she felt happy enough to include colorful slides. So over to you, Angeline.
Hi,
Okay.
thank you so much, Dr. Nuka, for this informative presentation. And personally, I found it really knowledgeable and helpful to have a clear pathway for a future career in the field of pharmacy. So yeah, now on to our second presentation on life as a pharmacy student by Angeline. On to you.
Okay. Let me share my slide. Okay, I think you guys can see my slide lah. So, I'll just introduce myself again. Hi, guys. My name is Angeline, and I'm currently a third year pharmacy student in Taylor's, and also a student under Dr. Renukha as well. So, today I'm just going to share a bit about my life as a pharmacy student. I think most of it is covered by Dr. Renukha at the end of her sharing. So, yeah, I hope I can provide like a different view from a student's point of view. How is it studying in Taylor's as a pharmacy student, and how I actually got into pharmacy from all of the healthcare fields that's available. So yeah, before pharmacy, I actually had interest in sort of like healthcare field. So that time I was thinking if I should go for computer science or something in the healthcare field until, in SPM, there was a topic in chemistry which talked about medicines like paracetamol, codeine, and all those like very common medicines. It's a very small topic, but it kind of piqued my interest. And so I decided that, okay, maybe computer science is not for me. So I went to the healthcare field, and yeah, at that time, actually my parents, they want me to become a nurse, but because I'm a tomboy, so yeah, I told them that I'm not going to become a nurse because I might kill that patient indirectly or directly. So yeah, I went for pharmacy because I'm also not a A plus student. And so that was at the start of Form 5. So during the whole Form 5 year while I'm studying for SPM, I also did like sort of a research. So basically I went to like hospitals and like my local retail pharmacies. Then I asked them like a lot of questions. So example of the questions I asked, can I find a job? I think that's the first question that all of us will ask because we all heard that rumor that we can't find a job because there's too many pharmacy students or pharmacy graduates in Malaysia and all of them have to go overseas. So yeah, that's the first question I asked. Can I find a job? Do I have to memorize a lot of medicines? Is pharmacy hard like medical school? Do I need to be good at chemistry and biology? Because that time, I think I hated chemistry, but I love it now lah. So yeah. And will I have a life? Okay, will I have a life is like same like is pharmacy hard lah. So basically, because what I heard was, as a pharmacy student, you don't have a life. You only study and you only memorize drugs. I didn't know that I have to learn other stuff like physics and some of the human anatomy. I didn't know. So I didn't bother to go and ask like lecturers as well. So I think that's a mistake that I made. But yeah, all of these are questions that I asked. But at the end, right, actually, my brother actually told me that, if you're good enough, someone will want you to work for them. So yeah, I came to pharmacy without consulting any lecturers, any education counselors, whatever. So, okay, after I joined pharmacy, there I do have my expectations, and expectations versus reality basically is like, okay, I thought I only needed to know chemistry. After I finished my foundation, actually I quite like chemistry thanks to the foundation lecturer. So I thought that I only needed to know chemistry. That's why my chemistry marks was quite high. But in reality, I had to learn about biology, chemistry, physics, and also maths because we have physical pharmaceutics for industry and also biology for human anatomy and all the cells and whatnot. We don't learn about plants that much, but yeah, biology is a must because we did learn about human anatomy in our first semester. And expectations, life is just to study, but I'm involved in a lot of like clubs and societies right now. Yeah, I still have time for extracurricular activities lah. And also expectations. Pharmacists are either in the hospitals or in retail. So basically, every misconception that I have that Dr. Renukha mentioned just now, it's actually just describing me lah. So yeah, I thought that pharmacists are either in hospitals or in retails dispensing medicine. Like, I give you a piece of paper where I don't even understand what the doctor just wrote, and you will magically like just translate that prescription and then give me the medicines that I needed. So no, there's different departments like what was shared just now. And I thought I'll be only learning about medicine properties. So this was covered in pharmacology, where we learn about like medicines, their names, their mechanism of action, how they interact with our body, how they were, processed through our body, how they work, and what's the side effect, what to look out for. I thought we were learning about those, but we learn so much more like formulations, patient counseling, even law, which we have like an exam called QEPP, qualifying examination to practice pharmacy. I think that's the full name. But basically, we call it QEPP, and we have to learn it and pass that exam in order to be like a provisionally registered pharmacist in Malaysia. So, and also industry guidelines lah. So basically, pharmacist is not just dispensing medicines. We learn other stuff as well. So yeah, those are the expectations versus reality. And also, I have cultural shock because our timetable are packed with classes. Like we start at 8 a.m., not every day, but almost every day. We start at 8 a.m. and then we end at 6 p.m. Sometimes we even end at 7 p.m., maybe 8 p.m. because we have like 3-hour like lab classes, 3-hour practicals. And starting from year 2, I think, we have assessments almost every week starting week 5. So it could be like when other courses, they have their independent learning week, they have their holidays, or their exams, their timetables are not that packed, but we're just continuing to go to classes Monday to Friday, sometimes Saturday, and every week we're preparing for something. It could be quizzes, presentations, it could be assignment presentations, and it could be midterm exams. So a lot of stuff. We're just continuously preparing for something. And the workload, I just said just now, presentations, assignments, quizzes, discussions, PBLs, problem-based learning. I think my seniors also have a simulated case discussion where we are given like a clinical case. Then we have to analyze it, find what the problem is, give recommendations and all that. So yeah, it was quite hectic, but it's still manageable. It's just the time management need to be very good. Then the third one is independent learning. So basically, right, this was just my experience in Taylor's Pharmacy. I don't know other universities. Basically, our year 1 and year 2, we were guided by lecturers. So yes, it's just like normal classes. But starting year 3, which is this semester, I realized that, okay, towards the end of year 2, actually there's some parts of this as well. Basically, we had to start learning on our own. Not like the lecturers will just, you guys learn on your own, but we need to fill in knowledge gaps. So basically, the lecture notes that the lecturer gives, they try to cover everything, but there will be some knowledge gaps that you have to go and search for yourself and like make connections. So basically, in the final exam, let's say pharmacology, the lecturer is able to connect something from topic 1 to the last topic. So you can't just say that, oh, you look at this question and then it's only covering this topic and I don't need to care about the other topics. But it covers everything. So yeah, we have to try to make connections between the topics that we learn and just learn independently because no one is going to spoon feed you everything. So during the end of year 2, actually, I always go to the library. I was always on my laptop trying to find informations because sometimes I'm just scared that I miss out something. So yeah, that's where some of the stress came lah. Then attention to details. This basically means the presentation slides, our assignment formatting, and also the knowledge gaps just now. Presentation slides. Okay, actually this presentation slide that I'm showing right now, it's template lah. I didn't design it myself. I don't really have that much time. But thank God I find a template that I think is suitable for this. So yeah, that's the attention to details. Sometimes the lecturer, they will, sometimes they will feel nicer when your slides are good. Okay, I'm not sure if I'm making sense, but yeah, we pay a lot of attention to details in our classes and our assignments. And I think this is sort of a given, but in pharmacy, I have very, very smart classmates. It's like no matter how much I study, there will be certain classmates that are even more smarter than me. Like if the lecturer asks something in the tutorial sessions or during presentation Q&A, they are able to answer everything. I don't know how they did it. I think they're Superman, Superwoman. But yeah, I had to accept the fact that I'm not really a A+ student. I'm just a normal average pharmacy student trying to do my best. So it was quite a hit for me because I did quite well in foundation, but now still okay. Yeah, I already accepted that reality. And also lecturers' willingness to teach. Okay, this one I must highlight because during my high school, actually I hated chemistry. Like I hated all the science stuff. I also don't know why. I don't think me from high school will know that I will be studying pharmacy now. But in high school, the lecturers just teach you because you need to sit for exams like SPM or IGCSE or O-level. I don't know about the other schools, but for my high school, it's like that. But in Taylor's, my lecturers, they are willing to teach lah. Like basically, there's one time where I emailed my lecturer about something that's not like included in our syllabus. I thought he's going to ignore it actually, but he took whole afternoon, not the whole afternoon lah, but he basically replied me with all of the clinical evidence, all of the references, and then tell me, oh, from this paper, you can see that it's actually like this, like this, like this. So if you want to read more, you can read this paper and the references after that. So I think that kind of show how passionate that the lecturer I met are. And it's quite a shock for me because in high school, if I ask things like that, right, they will just say, go and read on your own. It's not in your syllabus. You don't need to care about it. So yeah, that's some of the cultural shock that I have lah. Then on the other hand, okay, so basically before this, I think I'm scaring you guys. But on the other hand, it's also quite nice to study pharmacy because the more I study, actually the more interested I am. Like if I say that my interest in pharmacy in semester 1 is maybe like 2 or 3 out of 10, I think now it's around 8 to 9 because the way the lecturers teach, the way the modules are taught to us, it's quite interesting, and then you can feel the passion and how much respect they have for the profession. And also the practical classes, I think that's how all of us have fun lah, because if you see the pictures over here, it was taken when we were making our own cosmetic. So basically we made our own sunblock, we made our own lipstick basically, but of course cannot use because it didn't went through quality assurance. So yeah, but it was quite fun, and I remember it was one of our favorite practical classes. Of course, it's not just this one. We also had others, like how we made our own paracetamol, we synthesized our own drug, how we made our own tablets, capsules, and even this semester we're going inside aseptic suit to make like those vials that you break, the glass vials. So it was quite fun. And of course, I made a lot of friends through maybe group assignments or events that I will get into later, or just like random lunch gatherings. So basically, because all of us, we know like how hard it is to study pharmacy, all of us be like, okay, we'll just complain over lunch, just try to relax before our next quote unquote torturing lecture came. So I think that's how we bonded, and yeah, I now have a lot of friends lah. And also personal growth. I think that one is mainly thanks to our assignment presentation, because some of the lecturers every week also we have presentation, even though it's not a big one. But now I can confidently say that I'm quite okay in presentations lah. Like this one, actually I don't have a script, I wanted to prepare a script, but I think I'll just wing it lah. If I just use a script, I'll sound very robotic. So yeah, I think that's one of the growth that I have. Also public speaking, decision making and critical thinking, all of this, half of them are developed through academic side, which is our assignments, our presentations, but half of it is from TUPSS, which is our extracurricular activities. So yeah, we do have life outside the classroom. We're not just stuck inside the library or inside the lecture halls. So just to clarify lah. Okay, so I'll just talk about the pharmacy related clubs and societies. So in Taylor's, we have Taylor's University Pharmacy Student Society. There's a typo there. We call it TUPSS. It's just a pharmacy student society under Taylor's. So outside of that, we have Malaysian Pharmacy Student Association, MyPSA, which covers the whole pharmacy student population for Malaysia. And then we also have Malaysian Pharmacy Society, Young Pharmacists Chapter, and PSYPC. So basically, right, all of the pharmacies in Malaysia, I think, is under Malaysian Pharmacy Society. This one is national. Then under MPS, we have several chapters. So Young Pharmacists Chapter are those who's like senior students and fresh graduates. So if you're inside the MPS YPC, you'll actually be able to interact with all of the fresh graduate seniors, those who are already working, and also they organize national events lah. So another branch under MPS, the student chapter, is Malaysian Pharmacy Student Association, MyPSA, which covers the whole pharmacy student in Malaysia. Then they also organize national events and competitions like MPDC debate competition, the upcoming one, and PRC research competition, national pharmacy competition, sports carnival, whatever, but it only covers for pharmacy students. Then under my PSA, we have all of the local university societies. So basically, even if you don't study pharmacy in Taylor's, you go to, let's say, SEGI University, Monash, IMU, they will still have their own local society. So basically, if you guys are in those universities and then you go to my PSA events, all those national events, we eventually will meet somewhere. Okay, so yeah, basically MPS, MPS YPC, and then another one is my PSA. Under my PSA, the 20 plus local universities that we have. So for TUPSS, we also organize a lot of events, but this one only covers for pharmacy students in Taylor's. So our first physical event after the pandemic is blood donation drive. Then we also have our annual gala night, which we send for us to sort of wind down from final exams, and then sort of send off our year 4 seniors. Also team building, where we just had to welcome all the year 1 students. Of course, this is not all the year 1 students. Some of them, they didn't came. Okay, so I was also involved in my PSA because Taylor's was actually the hosting university for the 5th my PSA National Pharmacy Research Competition. I'll just say NPRC. It's a mouthful. So we hosted that, and also our seniors also won lah. So basically, there's a lot of national events that's under my PSA, but the student body that's going to organize those events are the local university student society. So basically, maybe 2022 NPRC will be hosted by us, but next year it will be hosted by another university, and then maybe we will host something else, maybe no gaps or whatever. So yeah, but also they have their own organizing committee, their own BOD, board of directors, sorry. So if you want to join my PSA, also can. Just need to apply through their social media, and you have to be a pharmacy student and also a member of my PSA. That's the only criteria. Then outside of that, we also have NPS YPC, where we just mentioned just now. So for NPS YPC, I joined because one of my seniors pulled me in, and I joined one of their flagship event, which is the Malaysia Community Pharmacy Business Forum. Okay, my CPBF. Okay, so the picture shown here was just one of the dinner gatherings that we had to discuss over things, but also that's when I learned a lot about maybe pharmacists in industry, medical science liaison, sales and marketing, medical affairs, regulations. Their working experience lah basically. So throughout all of these events, right, I know a lot of friends from my own batch, from my own university. I know people from other university, and also I get to learn more about the pharmacy profession through the seniors, through MPS YPC. So yeah, I think that's one of the advice that I want to give to all of the students here. Maybe even if you're not going into pharmacy, no matter which profession you go, don't just, get stuck in your own university, go outside, then mingle with everyone else, because you never know. You might get opportunities or chances, especially from the seniors. Okay. So other than pharmacy related clubs and societies, I also joined a student ambassador star and also Taylor's Chinese Society. So basically you can see that I joined a lot of stuff. So my timetable is always packed with meetings, deadlines, lectures, tutorials, practicals, assignment meetings, whatever. Cause yeah, when you join a lot of clubs and societies, you have a lot of things going on, and then you kind of need to manage your time properly, or else you are going to suffer when exams come or when assignment deadline come. So yeah, so I'll just briefly talk through lah. Student ambassador is basically where I started building my confidence, and then Chinese society is where I stopped being an introvert. So I know people from other courses, not only pharmacy, and they also help me a lot. Like I get advice from business students, design students, creative design, creative media, computer science students, people who join photography club. That's how I learn a lot of stuff. So basically, right now, 2 years after I joined Taylor's, I basically know a bit of computer science, a bit about business, a bit about design, photography, all that lah. So yeah, you don't need to just focus on pharmacy. Aside from the curriculum framework, the minor, the extension that was mentioned just now, you can also go and join all these clubs and societies to sort of develop an interest or hobby that maybe in the future will be very, very useful for you lah. Okay, so last part. I think I'm going too fast, but it's okay. So I think they asked me to do some tips and tricks if you guys want to join pharmacy, or just some general study tips and tricks lah. So the first one is time management. I use a digital calendar with like notification and reminders because I always forget. Fact check is in pharmacy in Taylor's lah. We don't have a fixed timetable. So maybe in other courses, they have a fixed timetable. So Monday, this time, confirm I have this class. So I will just come to campus every week on Monday at this time for this class. So it's confirmed. But in pharmacy, our timetable is not fixed, and every week it changes. So you won't have a class that's repeating for the same time every week. I hope it makes sense. So that's why I need a digital calendar. I know some of my friends, they also use physical like papers, but that one is what works for them lah. So for me, I use digital calendar. I can use Google Calendar or Outlook Calendar. Then I use a method called time blocking. If you look at the photos there, I block my time. So basically for now, you can't really see for 8 p.m., but I block my time for 8 to 9 so that I know, for this time period, I'm involved in and some other stuff and I cannot do other stuff. Okay, let's say a friend say, oh, Angeline, do you guys want to go like makan dinner? I'm like, okay, sorry, I blocked my time for this event. So yeah, that's how you know like you're available or not available lah. And it makes things very, very easy because you have notification. Like half an hour before the class, I'll be like, hey, I have class later in half an hour and I haven't prepared. Okay. This doesn't happen often, but it does happen. Then I also block time for like deadlines and also assessment. So you can see the red color one, the bright red is assessment. So that makes me want to study early lah. So don't study last minute. If you study last minute in pharmacy, you will die. Okay, and also last tip, please revise within the week because every week, every day we're learning something new. Like if you see the timetable here, right, all the lectures, they are new topics, like really, really new topics I never learned before. So in one week, I have maybe 4, 5, 6 lectures that I have to revise. And then next week, I have another 4, 5, 6 lectures that I need to revise. So yeah, time management is really, really important, especially if you join clubs and societies. Some of my friends, they don't join clubs and societies. They only come for classes, but that's good for them lah. Maybe they want to focus more on academics, but for me, I hyperactive ma. So I join a lot of stuff. Okay, so for academics, I think this is what works for me and some tips, some tricks that I use to study for exams lah. So for my lectures, our lecturer will always give reference lists and learning outcomes. So learning outcomes will be at the front part of the lecture, and it basically gives you a guideline for revisions. And whatever that's extra in the lecture note, like maybe 40 slides, 50 slides, sometimes they are not inside the learning outcome, they are just like extra information. Then you don't really need to study and memorize them for final exams. But it's always good for you to go through to get a better understanding. But let's say if you really, really last minute study, which I don't recommend, then best to study based on learning outcomes. Then for reference lists, this is just for if you want a full explanation and deeper understanding, because I find that all the lecture notes that our lecturers give, they are very comprehensive and they try to summarize a whole topic in a textbook. Like one textbook, that topic may be, I don't know, 100 pages, and my lecture slide will only be 50 slides, and it tried to summarize everything. But sometimes I mentioned that there's knowledge gaps. That's why I needed the reference list to kind of connect the dots. So yeah, that really helped, and I only found this out last semester. So I missed it out for, I don't know, 3 whole semester or 4 whole semester. And yeah, the last one is mind maps. That one is just for me. I know it doesn't work for everyone, but it works for me. Basically, it gives me like a guideline to see, like in at one glance, I know what is going on in this lecture topic, and I can just try to quiz myself. Okay, so under this topic, there's subtopics, there's keywords, there's things that I need to memorize. So yeah, that's how I try to sort of do last minute studying. Not last minute studying, last minute review, like maybe 5 minutes before the exam. I try to quiz myself lah. So yeah, that's what works for me, but of course, it doesn't work for everyone. So if it doesn't work for you, then you can, so it's just a reference. So if it doesn't work for you, it's okay. Just go and find your own style of studying. Okay. So yeah, that's all. I hope I'm not going too fast or too slow. So if any question, I think there's a Q&A session. So I'll answer that lah. Okay, thank you.
Thank you so much, Angeline, for this informative presentation. It felt really beneficial to have these doubts on the future as a farming student clarified. So I hope this sharing session has provided everyone with some useful information. Now, without further ado, we can move on to our Q&A session. You can drop your questions down in the Slido link provided in the chat below, and please remember to indicate which speaker your question is for.
While waiting for that, Niranjana, if you don't mind, I would like to put a disclaimer here. Me and Angeline, we never went through our slides or checked our slides, okay? So we talked independent of each other. And this is the first time I actually hear a year two telling us, her experience. So I really enjoyed that. And Angeline, you had like what, 16 slides and you talked so long. Well done. Wow. Amazing. So, I just want to say that we didn't discuss our slides, and it was really very, very nice to hear from a student, because those curriculum that she talked about is something that we really went through and designed, uh, word by word. I went through them word by word, so it's nice to see that somebody actually appreciate that work, minus the assignments lah.
Yeah, it's really great to hear both the perspectives from the teacher and the student. So I feel like it's really beneficial. So now I will share my screen. All right, so the first question I think can go to Dr. Renuka. What is your strongest motivation pursuing this career?
Okay, honest answer. I used to be an achiever, like seriously achiever in my high school, my primary school, or wherever I go. And so I did very well for my SPM, and I'm a JPS scholar. So when I wanted to apply for a degree, actually I wanted to become a medical doctor. Being from a Indian family, and being awed by medical doctors, like also similar like Angeline, I don't know what's lying ahead, so blinded. So I wanted to become a medical doctor, but my mom was strictly against it. My mother is a nurse, and so she said, no, you're not going to work like that, and things like that. Then somehow I just landed on pharmacy lah. I probably knew less things about pharmacies than Angeline did, but I landed on pharmacy. Um, However, I never looked back. To be very honest, I just never looked back. Similar to Angeline, I enjoyed learning. I enjoyed the journey. I enjoyed the work, the job. Yeah, I never looked back. So my strongest motivation to pursue this career, I wouldn't say there was any strong motivation. I enjoyed the learning and the job, probably. Yeah.
Oh, that's great to hear, Doctor. I'm sure some of the participants here can relate to that with not knowing where to go. So they've come to the right place to decide. Okay, next question. I think can direct this to Angeline. Why did you pursue pharmacy as a career?
Technically, pharmacy is not my career yet. So yeah, but I think I mentioned just now because I had quite an interest in chemistry and also all the medications and all that. Because that time, okay, I don't know if there's any students here that wanted to become a doctor. I'm sorry in advance if I offend you, but at that time, my mindset was like, okay, doctors is just the one that's diagnosing you. The one that actually cures you are the medications that you're taking. So that's why I want to go pharmacy. So yeah, no
Yeah,
offense, no offense.
it makes sense. It makes sense. Okay, next question again for Angeline. What is your biggest motivation studying pharmacy?
Uh, okay, biggest motivation. I think it's the lecturers lah. Because I didn't know how big a role that lecturers play in like our studying sort of life as a student until I joined pharmacy. Because I mentioned before in high school, right, the lecturer taught me chemistry until I hated chemistry. Like I didn't even I just threw the book all over. Yeah, I didn't tear the book only. So after I came to Taylor's Foundation, then I liked chemistry. Then I think that because pharmacy, there's a very, very big role of chemistry in pharmacy. So like it's the main kind of pure science in pharmacy. That's why I took pharmacy. Then when I came to pharmacy, the lecturers here are very, very passionate. They are very willing to share their expertise or things that are not inside the syllabus. Like they won't say like, it's not inside your syllabus, go and study yourself. They won't do that. And also, yeah, they really like sharing. I don't know why. I think it's just a trait for all the pharmacy lecturers, but yeah, they are my biggest motivation. I look up to them a lot.
Well, I'm sure Dr. Renukha is very happy to hear that. Um, So next question, I think directed towards Dr. Renukha. Which one is more worth it, studying local or overseas in terms of career?
Firstly, I hope, Angeline, you are not giving socially desirable answers. And by the way, I don't teach Angeline much. I teach very little. So whatever that she's saying is about my colleagues and not about me. Okay. Which one is more worth it, studying local or overseas in terms of career? Okay. My personal opinion is to have some. It depends on where you intend to practice. Say if you intend to practice in Malaysia, having some overseas exposure is good. For example, mine was a twinning program, so I did my first 2 years here, and then I completed my second 2 years in the UK, and it definitely gave me a different perspective. So to me, it is good to have an exposure if you can afford it. But if you can't, there are other ways for you to get exposure. So there are certain things that me and Angeline didn't share there, because there's just a lot of things that we can talk about in the 4 years journey that you can do. But there are options, things like global mobility or student exchanges, which you should grab the opportunity, where you can spend a couple of weeks or even up to a semester overseas that can give you that exposure. Because you were saying that which one is more worth it, studying local or overseas, I assume you're talking about pharmacy, but I would say that in general, just the overseas exposure will be good. Um, but if you have plans of moving to other countries like Australia or US or UK. So you may want to consider having courses where either you can straight away do there the 4 years, or you want to do a training, or you do want to do an articulation program. So articulation are options where we provide to our students. You can do the first 2 years at Taylor's or in Malaysia. Other university also provide this option. First 2 years here, and then we have got an agreement with another university where you can transfer and then at the end obtain their degree. Example, you come to Taylor's as a Taylor's pharmacy student, and then you sign up for an articulation with University of South Australia. At in your semester 5, you move to Adelaide and you complete your pharmacy degree there. At the end of that 4 years, you get a pharmacy degree from University of South Australia. Nowhere Taylor's is mentioned. So those are some options of doing overseas if you can afford. But in terms of which one is worth it, I would say that our curriculum in Malaysia is good enough. It's just that an overseas exposure helps to build perspective and character. So that will be good.
Yeah, I'm sure a lot of participants will be pleased to hear that they have a lot of different options as you shared. So next question I think can go to Dr. Renukha as well. What is the most fulfilling aspect of your career as a pharmacist?
Okay, so it depends on where I work. The most fulfilling aspect when I was as a hospital pharmacist is really being able to be involved in the patient care. There'll be times where I knew the patients better than the housemans or even the specialists, because I'm the ward pharmacist. I see the patient in and out of the ward. I know their medical history, I know their family history, I know everything. So the most fulfilling aspect is just being able to directly be involved in patient care and help them to get better. I still remember he's not probably not two lah. He's probably about 3 or 4 years old, who came in with severe asthma. Just keep coming in for asthma. Then I found out the father unfortunately died due to asthma as well. And I was wondering, okay, so such a strong family history. And so I really spent a lot of time talking to the mother, and I identified that they have carpets at home, they have pets at home, in addition to that, very strong family history and poor technique. And so I counsel her for hours, for days, until every morning when I go and they're in acute cubicle, I will go and meet the parent and show how to use the medication and things like that. When they go back, I explain with the chart and say what you need to do. I never see the patient back in the ward. I hope for good lah. So those are the things that really give you good feel, especially when people, maybe during the counseling, medication counseling, when the person actually understood what they are taking for once after a very long time, that gives you a fulfilling aspect. So that's when I was in the hospital. Now, okay, in the community, I guess similar, but in just different contexts. For example, I still remember this 40-year-old chap. He came in with his wife shopping. I was in the City Mall, Watsons, shopping, and then he said, "Hey, you provide blood pressure monitoring. Can you check my blood pressure?" And to my surprise, it was like 190 over 100. I said, "Okay, did you just came from the car park? You know what? Go have a walk and then come back." Come back, it was still that high. Immediately, I referred him to the hospital. So those kind of things, trying to able to pick up things and help people share your knowledge gives the fulfilling aspect. Now, as an academic, unfortunately, I don't do much teaching. But this week I had I think 2 hours of lecture, and I really spent time reading and talking to the students. So after a long time, I felt good. So the fulfilling aspect currently is being able to share my knowledge. Yeah. So that's, like I said, it depends on where you practice now.
Yeah, it's quite a touching story. Okay, so next question, directed towards Angeline. What are some, I think you already mentioned this, but maybe you can explain it a bit more. What are some extracurricular activities or work experiences outside of school that you did or would recommend for pharmacy?
Uh, to clarify, I actually don't work in community pharmacies before, but it's an option lah because a lot of my friends during their sem break or when they're waiting for their SPM results to come out, they actually went and worked part-time in a local pharmacy. So I think that would come quite useful if that counts because actually we had this module called community pharmacy practice and then we have OSFI exams. So basically what we do, we try to detect what sort of issues the patient has, maybe asthma, COPD, or just normal diarrhea, vomiting, or whatever. And then we had to either refer them to a doctor or give them a medication and counsel them. So if you have work experience in community pharmacy, you would be very familiar with what's the first line sort of medicine to give in these kind of cases, how to use them, what's the side effect, what to look out for. I think that's a very strong experience lah. But if you don't have like work experience, let's say you don't want to go and work yet, extracurricular activities, honestly, anything works. Like you just need to train your communication skills. I think that's the most essential for not just for pharmacy, but for everything else. So yeah, I think that's my answer lah.
Yeah, it sounds quite interesting to be able to get work experience before you get your degree. So next question, again for Angeline. What subjects can we see from pre-U coming in handy during pharmacy degree?
Chemistry, biology, physics not so much, but we did use it for a while. Maybe some basics in mathematics would do, but definitely chemistry and biology. And just a heads up, I hated organic chemistry, but I heard that lah. Year one, semester one, I think it's principles of organic chemistry, and then it's organic chemistry all the way until now. So yes, chemistry basically.
Okay, next question, I think for Dr. Renukha. Do I need to take physics in my foundation for pharmacy? So quite similar to the question earlier.
Actually, no, the entry requirement is either physics or maths usually. So no, only chemistry and biology is a must.
Oh, okay. Next question, also to Dr. Renukha. What is the difference between pharmacy and pharmacology? I hope I pronounced that right.
So pharmacology is the science of drug, how drug acts to the body and what does the body does to the drug. That's it. It's very basic science, laboratory science, which you cannot see. Whereas pharmacy is more of the use of drug in people, and the various aspect of it. So that's what I can say in terms of lay term now.
Okay, thanks for clarifying. The last question for Angeline. If you could go back in time, would you have chosen a different pathway?
My answer is not because Dr. Renukha is here, but no, I don't think I did consider computer science or architecture, but at the end I still end up in pharmacy. So yeah, no.
I think that's good to hear for the people who are looking to study pharmacy in the future. Okay, so that's it for the Q&A session. 1 second, yeah. Yeah, so that's it for the Q&A session. Uh, The feedback form will now be sent in the chat box, and please don't forget to fill that out, as certificates will only be given to those who filled in the form. By filling up the feedback form, you can have an input in TLPMC's future events and let us know how we can improve. We hope that this event has helped you gain more insight about the field of pharmacy and hopefully build some confidence and motivation that you need to attain this dream. I would also like to sincerely thank Dr. Renukha and Angeline for coming and giving us their time. I feel like it's been a valuable experience for all of us, and I definitely had some of my own doubts cleared. I feel like participants will find it very useful as well. Furthermore, as displayed on your screens right now, will be TLPMC's social media pages, which you guys can scan the QR codes out and keep up on our club's events and activities. As always, thank you all for joining us here on a weeknight, and we hope that you enjoyed yourself and had learned something from today's session. That's all for today. Good night. Hope you guys had a good time.